Dr. Fatma, can you present the case?
Yeah. So today I took history from Mrs. Jessica about 11-year-old Mary, who's been having syncopal attacks for the last 10 months, which has increased in frequency in the last 3 months, usually associated with triggers, such as mostly emotional triggers, like how she had explained, like hearing sounds or seeing an unpleasant sight, and induced because of pain, and only once it was because of post-exercise. Apart from that, her growth is within the normal limits, and she does not have any difficulty in her school. It is not affecting her school performance. The only thing is she has gone to secondary, she has gone to the next level of school, and apart from that, mother says that the child does not have any sort of adjustment issues. So putting all these things together, I would give a differential diagnosis of most likely diagnosis of first vasovagal syncope. However, I would also like to rule out the other causes of syncope, such as cardiac causes, most probably long QT syndrome, or any heart pathology which involves the aortic valve, like aortic stenosis or coarctation of aorta, which is less likely because by now in her general examination it would have been found out if it was present. And in case of a diagnosis of seizure disorder such as JME would also be in my mind, which is juvenile myoclonic epilepsy, considering the age group. But it's from the history appears less likely, but it would still be my differentials.
Okay. So one is the vasovagal syncope, another is the cardiac causes or the neurological causes.
Yes.
So how do you want to manage this case?
I have taken a detailed history about this child, as Mary. So I would like to do a complete physical examination, including her vitals, do a CVS examination, and go for a complete neurological examination, as well as examine her BP, upper limb and lower limb, as well as sitting and standing BP. If there is a difference of 10 millimeters of mercury when the child between the sitting and standing position, then that is something that has to be noted, which is could be because of postural reasons, which would favor vasovagal syncope. Then apart from that, investigations, already a basic blood test was done, which showed no anemia, but I would like to repeat the CBC to check for anemia. I would definitely go for a blood glucose. And then ECG is something that I would definitely be doing. Then apart from that, EEG, I would, unless I have, probably I will ask the mother next time if it happens, if there is a possibility of recording the event, I would ask the mother to record the event. EEG would be something that would be on my mind. Probably that would be done after discussion with the consultant. Yeah.
You CBC, blood glucose, ECG, EEG. Does this child at the moment, does this child needs EEG?
With the history that I have gathered, like she says that there are obvious triggers, like when she hears an abnormal noise or when there was pain, and she had these emotional triggers points more towards vasovagal syncope. So at the moment I wouldn't go for an EEG, but however this is something that would be in my mind. And if the attacks are more common, and plus she regains her consciousness almost immediately. There is no post-ictal drowsiness. And so for the time being, I will not go for an EEG, but this is something that I would consider if in the future there is the history favors more in favor of a seizure disorder, or if the history is inconclusive, or if there is a doubt.
Okay. So any imaging you want to do for this child? Are you interested in doing imaging for this child?
Again, this is at the moment I would not go for an imaging
Okay.
because the history does not imply of any sort of space occupying lesion. But if further down the line, if there are any symptoms, then probably I would go for a brain imaging as well.
So now anemia, we already done by the GP and he said there is no. So blood glucose, ECG, you said. Anything else you want to do?
I did not. I did not explore further when the mother said that probably she is acting like a big girl. So maybe if I had had more time, I would have asked a little bit about her social history and probably her early introduction to alcohol or any sort of other activities. So if that's the case, if it was a slightly bigger child, maybe I would have gone for a urine toxicology. Or if it was a slightly bigger child, I would have done a pregnancy test. But at this moment, I would not go for any further tests.
3 minutes left.
Can you tell me how do you want to treat this child, the treatment? Because the mother is worried now about the attacks, 4 attacks every month.
Okay, so most probably if we are establishing that there is no cardiac, there is no other. If there is no other serious cause like some cardiac cause or some neuro cause, then if we establish the diagnosis as vasovagal syncope, then it is more to do with counseling the parents and telling them that over time she will get over this, and it is probably we could before the try to reduce the triggering events, or probably if she's wearing a very tight collar dress or something, then that can be loosened, or she can be asked to breathe deeply, or like what she's already doing, she can be asked to squat on her heel, and hopefully she should be able to grow out of this.
Okay. So avoid triggers, you said. Apart from that, anything else you want to ask the mother to do at the moment?
Like I said, probably I would have a discussion with the consultant regarding this child, and probably the next time if this happens, if it is possible to video record the entire event to see if there is anything else that is being missed.
Okay. Okay. Time finished, Dr. Ola, or still?
Remaining 53 seconds.